Welcome, everyone, to today's live trivia show, where knowledge meets quick thinking. Get ready to test your brain power in the fascinating world of ophthalmology. From the intricate structures of the anterior segment to the mysteries of the optic nerve, we're diving deep into the subspecialties that keep our eyes seeing clearly. You'll face 25 questions, each with 4 answer options. Only one is correct. The twist? The faster you answer, the more points you earn. To submit your answer, simply comment the number of the correct option or type the full answer. Ophthalmology is more than just vision. It's about understanding the delicate balance of anatomy, pathology, and technology. Whether you're a seasoned eye expert or just curious, there's something here for everyone. So sharpen your focus, trust your instincts, and let's get started. Reminder: 25 questions, 4 options, 1 correct. Answer fast, comment the number or full answer. Here comes question 1 of 25. Let's get those minds in gear. In Plateau Iris configuration, angle closure persists despite asterisk. 1. Pilocarpine 2%. 2. Peripheral iridotomy. 3. Cycloplegic therapy. 4. Argon laser peripheral iridoplasty. Comment the number or type the full answer to play. Ophthalmology trivia is no blink and miss. It's all about precision and speed. Plateau iris often affects younger patients with anatomically narrow angles. Stay sharp. Correct answer, peripheral iridotomy. 29 got it right. Shout out, Remo, Adam, Ahmed, Muhammad. Time for question 2. Let's dive into some ocular mysteries. Which mechanism causes ghost cell glaucoma? 1. Retinal neovascularization blocking trabecular meshwork. 2. Red blood cell hemolysis releasing hemoglobin. 3. Lens protein leakage after trauma. 4. Degenerated erythrocytes obstructing trabecular meshwork. Submit your answers now. This one's a real eye-opener. Ghost cells are degenerated red blood cells seen after vitreous hemorrhage. Fascinating stuff. Correct answer, degenerated erythrocytes obstructing trabecular meshwork. 18 players got it right. Well done, Adam, Radwa, native. Here comes question 3. Eye health enthusiasts, this one's for you. In rhegmatogenous retinal detachment, the most common site for retinal breaks in myopes is asterisk. 1. Superior temporal. 2. Superior nasal. 3. Inferior temporal. 4. Inferior nasal. Lock in your answers. Retinal real estate matters more than you think. Myopia increases retinal detachment risk, especially with lattice degeneration. Stay sharp. Correct answer, superior temporal. Well done. 49 players nailed it correctly. Adam, Mohammed, Ahmed, Usama, brilliant. Time for question 4. Let's zoom into the world of ocular tumors. In retinoblastoma, which feature on ultrasonography is most specific? 1. Vitreous seeding. 2. Retinal detachment. 3. Mass with internal vascularity. 4. Calcification within intraocular mass. Take a guess, ultrasound reveals more than meets the eye. Retinoblastoma often presents before age 5. Early detection saves vision and lives. Correct answer, calcification within intraocular mass. 43 players got it right. Muhammad, Ahmed, Radwa, Bishoy, excellent. Question 5 coming in hot. Ready for a retinal challenge? In neovascular AMD, the primary site of pathology is asterisk. 1. Retinal pigment epithelium. 2. Internuclear layer. 3. Inner limiting membrane. 4. Bruch's membrane. Think deep, literally. Where does the trouble truly begin? Lock in your answers. Bruch's membrane lies between retina and choroid, key in macular degeneration. Correct answer, Bruch's membrane. Well done. 53 players nailed it brilliantly. Shout out, Suhaila, Abir, Adam, Mohammed. Here comes question 6, Retina Experts, this one's for you. In proliferative vitreoretinopathy after RD surgery, the most common cellular source of contractile membranes is asterisk. 1. RPE cells. 2. Muller cells. 3. Microglia. 4. Astrocytes. Think cellular, who's doing the heavy lifting? Answers locking in soon, don't miss it. PVR membranes can cause retinal traction, major challenge after detachment surgery. Correct answer, RPE cells, confirmed. 28 players answered it correctly. Adam, Iman, Abir, Huggy Wuggy. Question 7 coming your way. Cornea fans, stay sharp. In keratoconus, the earliest topographic sign is asterisk. 1. Thinnest point displaced inferatemporally. 2. Scissoring reflex on retinoscopy. 3. Mean keratometry, CMEAN, greater than 48.0 D. 4. Inferior steepening greater than 1.5 D. Eyes on the options, choose wisely, every detail counts in topography. Keratoconus often begins during puberty and progresses into the third decade. Correct answer, inferior steepening greater than 1.5 D. 30 of 55 players correct. Well done Sarah, Abir, Adam, Ahmed. Time for question 8, ready? In Morins Ulcer, the mainstay of acute management is asterisk. 1. Topical corticosteroids plus systemic immunosuppressants. 2. Topical antibiotics. 3. Oral doxycycline plus vitamin C. 4. Oral NSAIDs. Think fast, ocular emergencies demand swift, informed decisions. Choose your answer now. Morins ulcer is a painful, progressive peripheral ulcerative keratitis of unknown cause. Correct answer, corticosteroids plus immunosuppressants. 52 of 58 players correct. Great job Remo, Usama, Essam, Ahmed. Here comes question 9, focus up. Coated line in corneal graft indicates asterisk. 1. Stromal rejection. 2. Primary graft failure. 3. Epithelial rejection. 4. Endothelial rejection. Eyes on the prize, choose wisely, corneal clues are key in graft health. Coated line appears as white cells on corneal endothelium during rejection. Correct answer, endothelial rejection, well done. 45 of 55 players correct. Remo, Mohammed, Iman, brilliant. Here comes question 10, let's dive in. Ligneous conjunctivitis associated with deficiency of asterisk. 1. Vitamin K. 2. Protein C. 3. Plasminogen. 4. Factor 13. Think biochemistry meets ophthalmology, locking your answers, future eye experts. Ligneous conjunctivitis causes wood-like membranes on conjunctiva, often in children. Correct answer, plasminogen. Well done. 37 of 54 players correct. Adam, Mohammed, Ahmed, great job. Here comes question 11, let's focus. Horner-Trentis dots are most commonly seen in asterisk. 1. VKC. 2. Trachoma. 3. Bacterial conjunctivitis. 4. Atopic keratoconjunctivitis. Tiny dots, big clue, think allergies, and lock in your answers now. Horner-Trentis dots are white limball spots seen in allergic conjunctivitis. Correct answer, VKC. Great job. 48 of 60 players correct. Mustafa, Mohammed, Remo, Mohammed, impressive. Question 12 coming your way now. Spherophakia is most likely to cause asterisk. 1. Pupillary block glaucoma. 2. Plateau Iris syndrome. 3. Phacolytic glaucoma. 4. Open-angle glaucoma. Think lens shape and pressure. Choose wisely, your answer could change the leaderboard. Spherophakia often features a small, spherical lens causing lens-induced angle issues. Correct answer, pupillary block glaucoma. 54 of 55 answered correctly. Abir, Sarah, Noah, Adam, brilliant. Here comes question 13, get ready. Somerink's ring formation is prevented best by asterisk. 1. Sulcus placement of IOL. 2. Small capsulorhexis. 3. Posterior capsulorhexis. 4. Adequate cortical cleanup. Think post-op clarity, lock in your answers, and let's see who's sharp. Somerink's ring forms from retained lens cells after cataract surgery. Cleanup matters. Correct answer, adequate cortical cleanup. 42 of 57 answered correctly. Adam, Assam, Muhammad, Radwa, well done. Time for question 14, let's focus. Which of the following statements about Elschnig pearls is false? 1. Type of anterior capsular fibrosis. 2. Occurs centrally and can affect visual acuity. 3. Caused by residual anterior lens epithelial cells. 4. Best treated by ND/YAG posterior capsulotomy. Think carefully, false facts can be tricky. Elschnig pearls often form after cataract surgery due to lens cell proliferation. Correct answer, type of anterior capsular fibrosis. 42 of 56 answered correctly. Ali, Nagla, Sarah, Mohammed, brilliant work. Here comes question 15, let's dive in. Negative dysphotopsia after IOL implantation is due to asterisk. 1. Sharp-edged IOL optic. 2. Poor fixation. 3. Pigment dispersion. 4. High astigmatism. Eyes on the prize, choose wisely now. Negative dysphotopsia often appears as a dark temporal shadow post-surgery. Correct answer, sharp-edged IOL optic. 53 of 55 answered correctly. Mr. Native, Noha, Mostafa, Radwa, well done. Question 16 coming your way now. Upgaze palsy, light, near dissociation, convergence, retraction, nystagmus, diagnosis? 1. Skew deviation. 2. Parnose dorsal midbrain. 3. Internuclear ophthalmoplegia. 4. Holmes-80 syndrome. Think fast, neuro-ophthalmology fans, this one's for you. Parnose syndrome often results from pineal gland tumors compressing the dorsal midbrain. Correct answer, Parnose dorsal midbrain. 53 of 55 answered correctly. Usama, Remo, Radwa, Muhammad, brilliant. Question 17, eyes on the prize. Pupils don't react to light, but constrict during near diagnosis. 1. Wernicke's encephalopathy. 2. Neurosyphilis. 3. Multiple sclerosis. 4. Horner's syndrome. Tricky one, think neuro, think pupils. Lock in your answers now. Argyll-Robertson pupils accommodate but don't react. Classic neuro-ophthalmology finding. Correct answer, it's neurosyphilis, folks. 45 out of 55 correct. Remo, Fadloon, Ahmed, Mostafa, impressive. Question 18 coming your way. Segmental iris movement, what's the classic cause here? 1. Pharmacologic mydriasis. 2. Horner's syndrome. 3. Holmes' atonic pupil. 4. Argyll-Robertson pupil. Focus on the pupil's dance, lock in your answers now. Holmes' 80 pupil often affects young women and reacts poorly to light. Correct answer, Holmes' 80 tonic pupil. 45 of 53 answered correctly. Shout out, Muhammad, Usama, Radwa, Mostafa. Question 19, let's test your scleral savvy. Which feature sets scleromalacia perforans apart? 1. Risk of globe perforation. 2. Presence of uveal show. 3. Lack of pain and redness. 4. Association with rheumatoid arthritis. Think carefully, this one's subtly tricky. Scleromalacia perforans is often painless, unlike other necrotizing scleritis types. Correct answer, lack of pain. 42 of 52 got it. Well done, Suha and team. Question 20, let's keep the momentum going. Dalin Fuks nodules are most common in 1. Voigt-Koyanagi harada. 2. Sarcoid choroiditis. 3. Birdshot chorioretinopathy. 4. Acute retinal necrosis. Eyes on the prize, choose wisely. Dalin Fuks nodules form between retinal pigment epithelium and Bruch's membrane. Correct answer, Voit Koyanagi Harada. 52 of 57 answered correctly. Great job, Lemon your uncle. Question 21, eyes wide open. What causes Arl's triangle distribution? 1. Random endothelial adhesion. 2. Passive corneal endothelial degeneration. 3. Gravity and aqueous convection currents. 4. Diffusion of inflammatory mediators from iris vessels. Think fast, answers coming in hot. Arl's triangle typically forms inferiorly due to aqueous humor convection currents. Correct answer, gravity and convection. 52 of 55 answered correctly. Well done, Abir El Beltaji. Nice work, Noha Mahmood. Great job, Mr. Native. You nailed it, Lemon your uncle. Question 22 coming your way. What treats intravitreal cysticercosis best? 1. Systemic albendazole with corticosteroids alone. 2. Pars plana vitrectomy with cyst removal. 3. Observation until spontaneous degeneration. 4. Direct laser photocoagulation of the cyst. Eyes on the prize, lock in answers. Cysticercosis is caused by larval tapeworms, often from undercooked pork. Correct answer, pars plana vitrectomy. 38 of 51 answered correctly. Nice job, Mr. Native. Well done, Remo, impressive. Great work, Mostafa Ashraf. Adam Isa, you nailed it. Question 23, let's test your neuro-ophthalmology knowledge. Which feature is mandatory for orbital apex syndrome? 1. V1 sensory loss. 2. Protosis. 3. Optic nerve dysfunction. 4. Complete ophthalmoplegia. Think carefully, this one's a classic. Orbital apex syndrome may affect vision and eye movement. It's an emergency. Correct answer, optic nerve dysfunction. 22 of 54 answered correctly. Nice job, Mohammed Fadloon. Well played, Mostafa Ashraf. Mr. Native, great work. Sarah Samir, nailed it. Question 24, almost there, stay sharp. Which muscle overacts most with DVD? 1. Superior rectus. 2. Superior oblique. 3. Medial rectus. 4. Inferior oblique. Trust your instincts, muscles can be tricky. DVD stands for dissociated vertical deviation, often seen in strabismus cases. Correct answer, inferior oblique. 38 of 50 answered correctly. Eptil M3 Wad, well done. Sarah Ali, great job. Mr. Native, still sharp. Usama Uwais, nailed it. Final question, let's finish strong. Patient shows left hypertropia, worse with left tilt. 1. Right superior rectus. 2. Right inferior oblique. 3. Left superior oblique. 4. Left inferior rectus. Think carefully, muscle puzzles can be tricky. The superior oblique helps to press the eye, especially during adduction. Correct answer, left superior oblique. 40 of 47 answered correctly. Muhammad Fadloon, great work. Adam Isa, nicely done. Muhammad Al-Gohari, sharp thinking. Ahmed Nasser, well played. Adam Isa takes the crown. Tied atop, Fadloon, Ba, No Adverse won, amazing job. Big cheers to Mustafa Ashraf, Dr. Mahmood, Dr. Samaya, and others. 67 players joined, what a game. Thanks for playing, see you soon.